In the fifth and final section, now we will talk about another condition which is suppurative thrombophlebitis. And in this, we will talk about the anatomy and pathophysiology of suppurative thrombophlebitis. What are the clinical manifestations of suppurative thrombophlebitis and how we can diagnose and treat this condition known as suppurative thrombophlebitis. Suppurative thrombophlebitis is the septic venous thrombosis of cortical veins and sinuses. So thrombo is for the thrombosis and phleb is for the veins. So it's the inflammation of the veins as a result of thrombus formation. So it's the septic venous thrombosis of cortical veins, veins supplying the cortex and the sinuses. So that's the diagrammatic appearance of thrombophlebitis. As a complication of bacterial meningitis, subdural empyema, so it can occur as a result of bacterial meningitis, subdural empyema, suppurative thrombophlebitis. Epidural abscess, infection in the skin of face, and infection in paranasal sinuses, middle ear, and the mastoid. So, suppurative thrombophlebitis, it can occur as a result of bacterial meningitis, subdural empyema, epidural abscess, infection in the skin of the face here, and infection in paranasal sinuses, middle ear, and mastoid. All these conditions can lead to suppurative thrombophlebitis, which is in septic venous thrombosis of cortical vein and sinuses. Anatomy and pathophysiology of suppurative thrombophlebitis, septic thrombosis of superior sagittal sinus. Common predisposing condition are bacterial meningitis, diploic vein route for spread of infection from the meninges. So in case of bacterial meningitis, it can lead to the thrombophlebitis, suppurative thrombophlebitis. The route of spread of infection is the diploic veins from the meninges. Infection spread to superior sagittal sinus. Extend from one sinus to another, superior sagittal sinus, one sinus affected, then it can spread to the next sinus, another. Thrombosis of superior sagittal sinus associated with thrombosis of superior cortical veins, small parenchymal hemorrhages, dehydration from vomiting, hypercoagulable states, immunologic abnormalities, presence of circulating anti-phospholipid antibodies. Thrombosis is always usually associated with hypercoagulable states. When there is coagulation is more, thrombus formation is more, immunological abnormalities are present. Contribute to cerebral venous sinus thrombosis. The complications, it can occur as a complication of acute and chronic otitis media, middle ear infection that can spread to superior sagittal sinus, cause thrombophlebitis, or as a mastoiditis, inflammation of the mastoid bone. Infection spread from mastoid air cell to transverse sinus via emissary veins or by direct invasion. So from mastoid, infection spread from mastoid air cell to transverse sinus via emissary veins and by direct invasion. All these are the routes from which the infection can spread from the mastoid bone. Bacteria in the facial vein can also spread, enter the cavernous sinus via these veins. Bacteria in sphenoid and ethmoid sinus spread to cavernous sinuses via small emissary veins. Common site of primary infection in this case is sphenoid and ethmoid sinuses, resulting in septic cavernous sinus thrombosis. So all these infections can cause involvement of cavernous sinus, cause cavernous sinus thrombosis and cause thrombophlebitis, and different sinuses are infected and that can spread. Otitis media can occur and it can spread. Mastoiditis can be the source of infection also. Clinical manifestation of suppurative thrombophlebitis: septic thrombosis of superior sagittal sinus. There is headache, fever, nausea and vomiting is present. Vomiting can also cause dehydration. There is confusion, focal or generalized seizures, rapid development of stupor and coma. Weakness of lower extremities is also present with bilateral Babinski or sign or hemiparesis. As complication of bacterial meningitis, whenever there is meningitis, we have knuckle rigidity and kerning and Brudzinski sign are characteristic features associated with meningitis. So they are also present if there is thrombophlebitis as a result of bacterial meningitis. Then we have septic cavernous sinus thrombosis, how it will present. There is fever, headache, frontal and retroorbital pain is present. Diplopia, ptosis, proptosis, chemosis, extraocular dysmotility, deficit of cranial nerve 3, 4, and 6, and hyperesthesia of ophthalmic maxillary division of 5th cranial nerve. So all these are the clinical manifestations of septic cavernous sinus thrombosis. Periorbital, retroorbital region is involved. There is ptosis and there is double vision, proptosis of the eye, chemosis, extraocular dysmotility. So here these are the features. Cavernous sinus thrombosis affects the periorbital region and proptosis and the ptosis. Also, the transverse sinus thrombosis can lead to headache and earache, otitis media, sixth nerve palsy, and there is retroorbital or facial pain is present. Diagnosis is by MRI, absent flow void within affected venous sinus. MR, magnetic resonance venography, CT angiogram, venous phase of cerebral angiography. Diagnosis of thrombophlebitis of intracerebral and meningeal veins is by the presence of intracerebral hemorrhage, cerebral angiography for definite diagnosis. So that's the how we can diagnose. We can diagnose by MRI, CT, and also by the angiography. Treatment is septic venous sinus thrombosis by antibiotics, by hydration because of vomiting. There is dehydration, removal of infected tissue and thrombus. Septic lateral or cavernous sinus thrombosis is treated by anticoagulation with heparin. Also, the aseptic venous sinus thrombosis is treated by surgical thrombectomy. Is aseptic, so thrombus should be removed by thrombectomy. Catheter-directed urokinase therapy, combination of RT-PA and intravenous heparin. So, tissue plasminogen activator and intravenous heparin is used for aseptic thrombosis. So that concludes our topic of subdural empyema, in which we also discussed two other conditions, which were the epidural abscess and the suppurative thrombophlebitis. So that concludes our today's lecture. Thank you for watching sqadia.com.